Where's that start?
So when's the furniture store open? I have not.
I do.
I What?
Good.
Sorry.
Well, you're all right. You did. It's all right. Okay.
They're excited. They're excited.
Well, she was complimentary of you anyway.
I did. I came on down here because I just got talking to him.
Is that good or bad?
I know. Okay, Doc, you're making me nervous. Okay.
Okay, welcome to the May 14th work session of the Elizabethtown City Council. Mr. Thomas will open with prayer.
Let us pray. Heavenly Father, we're thankful for this beautiful day. We're thankful for this community to live in. We're thankful for the employees that strive each and every day to make this a great place to live. Heavenly Father, we ask that you be with us during the meeting. The decisions that we make will be pleasing to thine eyes. Thank we ask today and every day in thy name. Amen.
And would you join us in the pledge? Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, we're going to talk about
Was she sitting there?
vaping, electronic cigarettes, and needle exchange. Boy, those are three big things we always want to talk about. So who's going to start?
I do have some local data for everybody. Yeah. Left click. All right. Okay. All right. I'd like to thank you for your time, first of all. My name's Donnie Gill. I work with Lincoln Trail District Health Department. I'm our harm reduction manager. Today we're going to just want to do a little bit of education piece about syringe exchange, what it is, what it means. Okay, the harm reduction syringe exchange program, it's a comprehensive program. We're trying to make their behavior safer, not only for themselves, but for all of us in the community. By comprehensive, I mean we do testing for hepatitis C, HIV, provide them with clean syringes, give them access to counseling, test for HIV, hepatitis C, and we also link them up with other services because these are people that are kind of falling through the cracks. They don't necessarily have social support or medical support, and we can link them up and get them taken care of. All right, the step to a syringe exchange, first of all, we assess the need, and we have determined that there is a need here in Hardin County. The drug overdoses, the numbers go up each year. We're assessing the readiness again. We're trying to get approval. We've already got it from our Board of Health. We're here again trying to present this information to you tonight, and then we'll take it to the county level as well. All right, these are some of the myths or arguments I hear against this program all the time. Biggest one is we're enabling them. The first thing, the fact is they're already using drugs. Again, what we're trying to do is make it safer for them and safer for all the members of our community, including our police, our first responders, our city workers, because syringes have been found in parks. So we are trying to, again, increase safety. It does not encourage individuals to begin using drugs. I don't think anybody's going to hear about a syringe access program and say, hey, I think I'm going to start shooting heroin tomorrow because I can get clean needles now. So it does not increase the use among existing users. Their rates, their usage habits remain steady. And it does not increase crime. Syringe exchange programs have been around for in excess of 25 years in this country. So there's been long-term studies. And again, the studies indicate that there is not an increase in crime. What they do is they save a lot of money. When you look at the cost of the supplies that we are giving our patients to access the program, the cost for needles and other paraphernalia that goes along with injecting drugs, it's pennies on the dollar. We reduce HIV rates. We are advancing public safety, including safety of law enforcement officials, because we're taking contaminated needles off the streets. It's an important link to mental health and addiction treatment services. We will have a partnership with CommuniCare, so we will have counseling available. It serves as an entry point for other healthcare services. Again, we provide HIV testing, hepatitis C, pregnancy testing, STD testing, vaccinations. The current hepatitis A situation is kind of illustrates the importance of this as well. We talk about overdose prevention, safe injection. So it is, again, a comprehensive program. And again, it's very cost effective when you compare the cost of treating a person for HIV or treating a person for hepatitis C. There's a lot of information on here, but I'll hit some of the highlights. The number of cases, HIV cases linked to people accessing a syringe exchange program in Washington, D.C., there was an 80% decrease. So, these programs do work. All right, here's another side effect that we're seeing with the opiate problem. It's the number of babies being born addicted to opiates. Look at the cases. There were 28 in the year 2000. That increased to 824 by 2012, and now the number is in excess of 1,200. For these babies that are born addicted, the average stay in the hospital is 16 days, and that's about a cost of, on average, of $53,000 per child. So any one of those we can reduce, again, it's for the greater good, and it saves us taxpayers a lot of money. Again, a very busy slide, but key I want you to take away from this one is people who access a syringe exchange program are 5 times more likely to get treatment because, again, they're getting exposed each visit. If you have a counselor on site, have information, education on site, you slowly plant seeds, and at some point when they're ready, they know where they can access treatment through. Okay, again, I referenced this earlier, but what we're seeing here in Hardin County, we have a hepatitis A situation. We're trying to contain that the best we can. With the people that we have vaccinated and diagnosed, 50% of them are IV drug users. 83% of those are co-infected with hepatitis C. So, it's already a pretty prevalent problem here. Drug-related inpatient hospital discharges and ER visits related to heroin have continued to increase in Hardin County. 338 inpatient discharges and ER visits were documented by HMH in 2016. And I'm sure that number has increased for 2017.
Wait a minute, can I ask a question? Can you go back to that? Thank you, all got it. All right, a total of 338 inpatient hospital and ER visits were documented for drug overdose, is that what you're saying?
Correct.
338?
Yes.
Okay, so how many hepatitis A, and 50% were IV drug users? How many hepatitis A cases are
What's our Hardin numbers up to?
Hardin residents, this resident, what is happening is are investigating several of them are not Hardin residents. Hardin County because they close to finding halfway houses, and I don't know what we've heard is that Jefferson don't have a lot of people. So. So that's why our county is 30% of the residents have no risk factors. That's why the Department of Public Health for all of the.
What are your numbers for HIV and hepatitis B?
Yeah.
Yeah, it is in the
being lazy,
handout.
Sorry.
Current 2016, Hardin County had 185 residents living with HIV. That was up from 173 in the previous year. So there's been a slow, steady
Well, you
increase.
said that's residents living in Hardin County, but is that separate from being diagnosed in the ER?
How do we break that up? Is it,
Okay, sure. Thank you.
okay, this was some data we got from the Louisville Metro Syringe Exchange. The highlighted areas are the Lincoln Trail Health Department. That's our area. Here we see Hardin, and we have Hardin residents traveling up to Louisville to access needles. I run our exchange in Nelson County. We have had Hardin County zip code show up there as well. All right, this is some data from our Nelson County Syringe Exchange. We've been open since July of 2017. We've had 70 people access the program over the course of 9 months, and that equals out to 206 visits. We have dispensed over 7,500 syringes and taken in 4,100. Now, I also talked to them because some of the patients that come in, they're very nervous about driving around with used syringes. So we talked to them about how they can safely dispose those at home as well. We're not finding them on the streets or anything like that. So they are doing a very good job of kind of policing themselves, I guess, and making sure that they're disposing of their syringes properly. It's a hard program to advertise. We tried the news, we tried print media. Word of mouth seems to advertise it better than anything. As for the 70 people that have access, this 62% are unemployed, but there's still, a decent chunk there that do have jobs. I have started to see more of a resurgence in methamphetamine use lately. When the program first started, I saw a lot of meth, then it switched over to heroin. Now I'm starting to see a resurgence in the methamphetamine. So we don't just have an opiate problem in the area, we still have a methamphetamine problem. All right, here's our hepatitis C rates. And we are below the state average. And the thing is, we want to keep it that way. And this program would help us accomplish that goal. Because again, they're not sharing needles, a contaminated needle. And something we have to take into consideration, 2 of our neighboring counties, Breckenridge and Grayson, made a list of the CDC's 225 counties most likely for an HIV outbreak. So we know that HIV is not going to stop on a county line. A lot of traffic between the counties that could potentially, get out of control in a hurry. This is a great area to live, great city. I would hate to see Elizabethtown in the headlines for an HIV outbreak.
But, excuse me, Donnie, 2016, does that mean our crude rate was 0 in Hardin County? Am I reading that correctly? So less than 1%?
Yes.
Is that what that means?
Yes.
Or is that actual number, that's a percentage, right?
Yeah, well, we had, 185 residents. But, we have 100,000 people who live here, so that's, very small percentage of the people. That answer that, I think?
Well, I mean, it just means that we were less than 1%,
Yeah.
I guess, is what I'm asking.
Yes.
And what is the point that what's a crucial point? Is that,
Do not have a hepatitis C outbreak, right? Well, hepatitis cases happen all the time.
yes,
Most
ma'am.
of the folks in the halfway houses, I went to a conference last week.
And the counties, of course, there that you're worried about the most are Marion County, or Nelson County, and what is the other one there? Marion County?
Breck and Grayson made the Centers for Disease Control list. Plus, we have I-65, which is a drug corridor, proximity to Louisville. So we're in kind of a hot spot here.
Right.
And we would like to keep those rates right where they are. All right, here's our cumulative cases. So there has been a slight steady increase there. But, the last thing we would want would be a Scott County, Indiana incident where they had 200 cases in just a span of a few months. Okay, with this data, it represents a total number of hospitalizations and emergency department visits for which the condition was mentioned, and not the number of unique individuals affected. Yeah, when we look at that data as well as far as the drugs, it's not necessarily, they might be smoking it, they might be snorting it, as well as injecting it.
So
So this isn't like if it says 185, it's not actually 185 people because some of them may have gone numerous times to the hospital. Is that what the first statement's saying?
This is actual number of cases in
Different
Hardin
cases,
County.
not the same people.
Right,
So when you reported the state and the CDC, it's a different name on each.
correct, correct. This thing's kind of loosey-goosey. All right, so here's our drug-related inpatient hospital discharges and ER visits. We've broken them down by substance. Now, 2012 is when the law changed as far as making it harder to access prescription drugs. That's when we started seeing the uptake in heroin usage. And from 15 to 16, it more than doubled locally. And here's the overdoses again. Here's the total number for, we got hepatitis C and HIV. When they come in to the ER, they're already coming in with these conditions. Held fairly steady, at least as far as the HIV. But again, we want to keep those numbers low. Any questions?
Connie, how many counties in the Lincoln Trail area have a needle exchange program, and how many counties in Kentucky have a needle exchange program?
We have, our only program is in Nelson County. And then I think they're up to 40 in the state, throughout the state. And some have been approved at this point, but they're not up and running yet.
So when they come in, if they have their needles, I mean, how many do you give them? They just one, or they come back several times? How does that work?
Well, when we first opened up in Nelson, we were only open one day a week. So I would give them a week's worth. So it would depend on how many times that individual injected during the course of the day. Because we didn't want them reusing, because then you start talking about they might have wound care issues or other injection related issues. So, if somebody shot up 10 times a day, I would give them 70 needles.
So they tell you, I
Yeah.
shoot up 70 times.
I had one told me she shot up 15 times a day.
Is there no liability on your part at all with giving someone a needle that they're going to shoot up with, and that you know that they're going to shoot up with?
No, I mean, I think we would look at more liability coming our way if we did not provide this service to protect our community.
There is.
The KRS covers the program guidelines for follow, so there is their liability.
Do you have to be a resident of Nelson County in order to use the needle exchange program in Nelson County, or just you can come from anywhere?
They could come from anywhere, yes, sir. I've had a Cecilia zip code show up over there. I've had some, mostly Nelson County, but then there was, I think, one from another outside county. I can't remember which one off the top of my head, though.
So how much time do you spend with them when the lady told you or the person told you 7 times a day? I mean, it's not just a matter of, oh, here's 70. You sit and counsel them, or somebody talks with them for a period of time.
Yeah,
to get some information.
Correct. I try to form a rapport with them because, again, I want them to see a friendly face. And I might be the first person to say hi and how are you to them all day. So I try to set them at ease. I would say average visit length is probably 15 to 20 minutes. Because a lot of them, they don't really want to hear what I have to say. They just want to get their stuff and go. Others are more receptive to it, especially the ones that have been coming to the program longer.
Mr. Gill, infectious disease is in my wheelhouse, and I certainly understand trying to, keep the bloodborne infection diseases down. But my concern is that the number of needles you've given out versus the ones that have returned, the 3,000 that are out there floating. You said you certainly personally you've not seen those needles laying around. I have. And that concerns me. I think they found one out there at the playground at one of the elementary schools. I had a friend tell me about this little hut at the corner of Freeman Lake, and that people were using that to take drugs. Went in there, needles laying in there. I called the police and notified them. So my biggest concern is these needles that are not given back, floating around out there, being disposed of in the trash can, and our trash haulers coming up, picking up those bags and sticking themselves with it. So that's my concern. And what are you all prepared to do to address those issues?
I give each participant of the program a small sharps container when they leave. So they have, whether they bring that to me or put that in the trash themselves, I told them I'm fine either way. Because I understand them not wanting to drive around with a bunch of dirty needles. I've had one letter written. They found a couple needles in their yard in somewhere in Bardstown. And that, we don't know if that came from us or another source. But again, the program, it does try to put a value on the needle and encourage them to come back with the dirty for the clean. Again, we don't want to find them in the playgrounds. We don't want to find them in the parks. We were told by a Subway employee, the Subway in front of Walmart, they're starting to find them in the bathroom there on a regular basis. Steak and Shake has had issues. O'Charlie's found a bunch by their dumpster. So again, if we can give them some kind of incentive to bring those to us, or at least dispose of them properly by educating them, then I think we accomplish a large part of that goal.
Okay, so the next question is, what do you want from the city government?
What we would want from you would hopefully be approval at some point. And just now that hopefully you understand the program a little bit more and what it's about, and it's not just a free for all. Here's some needles, see you later.
Of course, you all being the state health department, we don't have to give you permission. You would just like to have the city council back you on this initiative.
Well, the way the law is written, we do have to get city
You do?
council.
They do have to have our permission.
I'm surprised at that.
Are you also going to speak about the electronic cigarettes and the vaping?
I'm going to turn that over to my colleague Terry for that one.
Before we move on, Dr. Lee, I asked him to be here, but he has a legal actually, part where folks actually die and overdose on the time for that, or you guys?
Sure, we've got about, 10 more minutes before, she had 30 minutes for the next presentation. Sure, come on.
Come on, Dr. Lee.
We always have time.
Yes, we do.
Wherever you're comfortable.
One day we will all have time for you. population that more rapidly.
Yeah, Dr. Lee, I went to a DEA presentation a couple of months ago, and he says they're starting to see a trend of marijuana and heroin and cocaine laced with fentanyl. Are you seeing that rise in Hardin County?
Thanks, Dr. Lee.
Our purpose here today is to hope, we're hoping, because Elizabethtown already has an ordinance for banning cigarettes smoke-free. We just want you to add e-cigarettes to it. That's the goal of me coming to speak with you today. I think our primary concern is how it affects our youth and the fact that there's not been a lot of research on e-cigarettes, so we don't know the long-term healthcare effects. We don't know really what's in it. They're all labeled differently, and I actually brought some examples for you.
You know, I've never even seen these. You were talking about the smoke that generate. I had no idea she was gonna bring examples.
Now, this one that I'm getting ready to pass around looks like a regular cigarette. This is where we started. So this is kind of like at the beginning, where E6 first came out. And it's disposable, so it's a one-time use. You use it and you toss it.
You were telling me the other day that people can smoke these in a restaurant. You can walk in, and I've never seen that in E-town. Smoke in a restaurant.
If you saw it, it would be, you would know it because it's completely different from a regular cigarette. The vapor is like this big plume of smoke. So it's a lot more.
And that's legal in Elizabethtown.
Yes.
I thought there was a car on fire the other day.
Yes.
Yeah.
And
I've
it,
heard
you
a
know,
lot
it's
of
in his
people
car.
say that.
And all that smoke came out, I'm getting ready to call fire department. And then I saw it was his.
Well, no, I understand in their own car, but I thought we had taken care of all that.
No, we
Not this, it doesn't cover.
And so I saw a lady walking into Target yesterday, headed into there. Donnie saw someone at drug court. Someone mentioned Old Charlie, someone's actually smoking in the restaurant. So it's very common right now, and we would like to increase the use of that.
Are there counties in the Lincoln Trail area that have ordinances that ban specifically? Or
Nelson County.
which
Bardstown
bans
City.
e-cigarettes?
Yes, it does, and it has it written in that ordinance. We actually bought a sample ordinance, just in case you wanted to see that. As far as how you can include that right up in there and make sure you include the right language. This is another, this is called a tank, if I'm not mistaken. And so this is the.
Did you have to try these to?
Oh, no. No, I'm just, that's why I wanted to explain it up to the point where you hook.
Okay.
But this actually unscrews here, and you'll see a chamber where the little vapor liquid fits in there, and it's
magnetic, so it fits there, and you hold it here, and you inhale and puff. That's how
So you
that
don't
works.
light it, it's just,
Yeah, no, they
makes it
charge
smoke.
it. It's chargeable.
And not to interrupt Terry, but these are heavily marketed to our team.
They are.
Safe
Look how
and
fancy.
to the safe alternative to smoking, but they flavor them with strawberry, grape. And so you'll see a lot of teams, even in the parking lots at schools with them, because you can, a lot of times they wear them around their neck, and most people know, like this, so a really, the jewel.
This is a lanyard that the e-cigarette will fit in. So this is only made for e-cigarettes. So if you see one like this, you know that it is, someone has an e-cigarette.
It's on the store.
so you said the schools allow them? Is that what you just
They
said?
don't allow, but they don't, we had to educate a lot of the teachers and administration on what they are, because they make some, you have the tool, and then.
No, the jewel is like a USB port. Yes, and you can charge it on your computer, so there's not really a way to tell. And you puff on it, and it, you know, you get the.
No.
Yes.
Okay, now don't we have stores or restaurants or bars or wherever that are for this and this only?
They buy them.
Yes.
You know what I mean, where they
Where
sell.
they can use it, where they can use it.
Vapor bars and hookah bars.
That's what I was thinking. So those, what you're saying, if you're wanting an ordinance that would also do away with those places.
Well, at least limit where they can smoke them. That's what we're going for. Smoke free. You already have it smoke free in your stadiums, your arenas, just pretty much everywhere.
Restaurants.
Yes. So in their own homes, of course, but you know, places that public places, that's what we're asking for.
So those bars that already have this, you would let them still do what they're doing.
Sure.
We've never really.
Well, vape stores, I think logically we would let
Yeah,
them do
'cause you get
that.
examples.
If they, yeah,
It's just the public places.
'cause I don't think. you
But
can-
Bardstown,
With the
Bardstown
port
ordinance
that-
prohibits e-cigarettes then anywhere.
As far as
Any,
like
any
smoke,
preliminary studies on the susceptibility to influenza when using e-cigarettes? Yeah, like the cigarettes, of course, cigarettes kill the silly other respiratory cells.
Yeah.
We've seen the same thing with the e-cigs.
There's not enough data out there right now, sir, for anything. I mean, they're still trying to regulate
Right.
it. So the studies are
We-
very.
We
far.
considered, you know, at the time we passed our smoking ban, we considered that. And the research at the time was, of course, the main focus is to avoid secondhand smoke, you know, people who don't want that. But we didn't, there wasn't research out there at the time that said that this was damaging. So you would say that's that, I mean, or are you saying, is the research out there now that says that these are,
Moving towards that, we're
Yeah.
finding more as each year passes. For example, we do know that because the nicotine is not, first of all, a lot of these things are labeled nicotine free, and every test that's been done on them contain nicotine.
Okay.
So we know there's an addictive factor related to these. We also know that the nicotine can be exposed in the air, so they have tested and found nicotine samples in the air as well. What I hate, dislike the most is the fact that our youth who start using these cigarettes are more likely, the e-cigarettes are more likely then to progress to cigarette use. That's probably the biggest thing.
and there are
So we
studies
find
out there
out
that are
more.
verifying that, you know, for
Yes,
us. I mean,
there are
yeah.
studies out there that
Uh-huh.
verify that. Yes, there is.
How long has Bardstown had their ordinance?
You might be able to look at
It's been
the-
a day or
yeah.
What's it say on the front there, Shep? Should be on the top.
Yesterday.
I just wondered if they.
2010, 2010.
10,
Oh, okay.
okay.
When did we pass our smoking ban? It's been like a good 10 years, hasn't it?
Yeah.
When?
No, they
In 6?
drink.
Okay, all right.
Drink.
Yes, I just need to make sure I get on the front
Come on, bring it back.
Mary's trying to keep.
He's gonna be vaping now.
Are you leaving this sample with us?
Yeah, I'll leave it with you. Okay,
Send it back to you.
okay.
Thank you.
Thank you.
Scott Reynolds, you want to,
I gotta give him his vape pen back.
all right.
Alrighty, oh, there's his regular pen too. That's nice. Work a little magic here. I've got Brad Boaz with me today from CMW, and I'll let him introduce his team to talk about the renovations of, either way, the renovations of City Hall. Just to let you all know a little background, Charlie, Ed, Jeff Hawkins, and myself have been on the design committee for working with CMW and their folks on how to renovate City Hall. And then Kelly Johnson, Sarah Vaughn, and Kim Compton have been working with the interiors design with Brittany on because they didn't trust us guys to pick out colors. So we had to go to the experts and yeah, very smart move. I still think Transformer green's a pretty color. So, so just that little bit of background. I'm going to let Brad do the majority of the presentation, and then we're all here for any questions you all might have. So, Mr. Boaz.
Good evening. My name is Brad Boaz with CMW Architects out of Lexington. Today I have Mike Childers with Icon of E-Town with me, Brittany Seda from Kathy Burgess Interior. So we're all here again with the team that Scott described to help answer any questions you have. I'm going to do an overview of all the things that we're trying to do with City Hall. And they're broken into sections, so you can ask questions if it comes to you during the presentation, or at the end of each section, I'll kind of stop and see if anyone has any questions. So we're going to start with the exterior. If you look at the exterior from the outside, obviously there's some issues. If you get up close and look at the brick, there's lots of cracks in the brick. Some of it's failing. But then when you're on the inside, you can really see some of the issues with lots of the drywall, even in this room around the windows, or lots of evidence of water damage. And that's pretty much consistent throughout the entire building. So this is one of the primary objectives of the project. And so we're going to talk about it first. And this has been a lot of the work, or most of the work that Mike's been taking care of. So Mike will jump in here if I miss anything. So a few weeks ago, the Public Works Department provided a lift for Mike to get up there and take some pictures and show you just a lot of the real up close conditions that are consistent all the way around the building. On the left here, you see cracks in the mortar. You see actual brick members that have broken in half. That could be from freeze thaw, from rust jacking of the steel lintels. On the left here, you see some caulking of windows. That's probably caulk that's been replaced a number of times, that is dried out and is just in a wide open area for water to infiltrate the building envelope. Here's a picture on the north side of the building, and it's hard to tell from this image, but above the window here, you can see a lot of discoloration in the brick where it's darker, just a clear evidence of moisture that's in the brick, and that airflow is not getting back there to help dry it out. And so it's basically trapped in between the building brick and the interior facade. And then again, you've got a crack here that goes along the mortar joint up a number of courses along the back facade of the wall. There's been from talking with Charlie and Scott, there's been a number of times where people have come to help shore up the facade with either caulking of it or remortaring the joints. And while that helps, it's just a Band-Aid, because eventually it's going to continue to open up and to crack again. And so we see evidence of caulking that's only a few years old that is continuing to fail. One of the most interesting things we found is that over the window sills is a bead of caulk. And the problem with that is that when someone came back later after the building was built to do that, they didn't realize is that they were sealing up the flashing here that was designed to let water escape. So while someone had all the best intentions, they've actually covered up areas for water to get out. And you also notice, if you look closely, there are no weep holes in the building. And so that's one of the primary ways for air to get in and water to escape is through weep holes above the windows and around the base of the building. And none of those are present. That could have just been the way the building was built, and then they may not have recognized that when the building was remodeled back in the 90s. And so that was the primary thing Mike found, and thought that, we have to get that caulk out of there because the copper flashing is holding up fine. It's just we've covered up the areas for the water to escape. You also see some of the stone members are cracking as well, so we want to replace those while we're doing this work on the facade. If we move to the front vestibule, when this was placed on the building with the renovation, they just basically pushed it up against the building, bolted it to it, and then caulked around it. So there's no flashing actually inside the brick facade, and so over time that connection is going to fail, and water is going to be able to penetrate inside the vestibule. And so when it's on a really rainy day, when you all walk in the building, you'll notice there's moisture and there's water in the front vestibule. So Mike's going to create a detail, or he has created a detail in order to seal up the vestibule there at the front. On the roof, if you've ever been to Jeff Hawkins' office, you have seen the water damage that he is dealing with continually.
Marks now, isn't it? That Mark's office?
And so we can only assume that the chimney is the main culprit for that situation. Just not looking at any of the attachments, just the brick itself is failing in a number of places. The mortar is falling apart. But then over time, as technology has developed, you've needed the chimney for an antenna connection so you can get communication in and out of the building. So as that evolves and you take something off, put it on, usually that leaves a hole. And so this guy right here just seems like a major entry point for water to get into the building, get in Jeff's office. It even goes down to the second floor in Ryan Sharon's office. So we want to take all this off the chimney, put it on its own independent stand on the roof, and then seal this up with shiplap siding so that it completely eliminates water infiltration at this obviously main point of entry. We'll move inside the building in the basement. On a really rainy day, there's water that stands by the elevator on the south side of the building. In doing some investigation, we found some holes in the plumbing where that's just rotted away over time. Mike found a crack in this building wall over here. And so we've come up with, again, details for getting into there and sealing up the crack, for replacing some of this plumbing, because we feel like when it rains, water is coming through here, coming out of, spilling out of the top here and flooding the basement when the water is really coming down outside. And so these are some of the points that I've talked about, but these are the things that we are going to try to repair. We're going to repair with the building facade. Installing weeps, again, is very important to go through above all the windows and around the base of the building. Removing the caulking where the flashing where water is supposed to escape out of the facade. Replacing the old window caulking and putting new where we saw it was cracked and leaving gaps. Tuck point, the crack joints. So this is an interesting topic here, the crack joints. Who knows how many lineal feet of crack joints there are on the building. We've talked about how to bid this to a contractor to provide a fair price to the city and a fair deal with the contractor. So we're talking about providing a lineal footage of jointing that they're going to have to repair, say a fixed number of 1,500 lineal feet. And, they'll work with us and the city to show how they're doing that at all these specific spots. Because we don't want to say fix all the cracks, because then they're going to put an outrageous number to literally fix every single mortar joint in the building, and that will blow the budget and we'll be able to do the project. So we're still in talking with the city about how we best represent that on a set of plans, because if you talk to any engineer architect, a renovation is the most difficult thing to quantify for a contract. And I know we've had difficulty getting good bids, so we're trying to think through these things that the contractor is going to be thinking about and trying to get the most accurate set of plans possible. So they bid, and we know what they're bidding, and they're not fudging numbers. So we're thinking about putting some allowances in here to say, all right, do this much, and when you get to that point, prove you've done it, and if we need to do more, we'll have a unit price that tells us if we want to do more, this is how much it's going to cost. So it's all fair upfront at the time of bidding. Seal the entire building with a siloxane water repellent. So if we don't get all the cracks in the building, there's still some hairline cracks that we'll never see. So what Mike's proposing is to coat the entire building with this siloxane water repellent. And that just helps water, as you can imagine, just hit the building and run right off, as opposed to absorbing into the brick, into the mortar, which has become very porous over time. And so this isn't a one-stop fix that fixes it forever. This will have to be reapplied. But every couple of years, you've got this solution on the building that just helps water run off and get away from penetrating inside the building. So that's very important to do over the entire face of the building. Provide through-wall flashing at the vestibule, as we talked about, just getting that flashing inside the building facade so that water doesn't have room to get inside the little vestibule there. Cover the chimney with the siding. Fix the crack in the basement. We'll have to take out a portion of wall to do that near the elevator, but that's the only way of getting that crack completely sealed so groundwater doesn't get inside the building. Fix the corroded pipe in the basement. And the last thing is pump groundwater from the storage. Now, in the northeast corner of the building, when it rains hard, only when it rains hard again, there's sometimes standing water in that storage room if you've been there. It's got a lot of old files in it. And so we are going to propose cutting out a section of that floor, putting a pump in there with a perforated pipe so that whenever that groundwater starts building up, it gets in the pipe, gets in the pump, and is pumped out of the basement. There's not a lot of options in that situation because it's an existing building. We're going to have to cut the floor. But, you know, the city said we've got to prevent water from getting into this room in the basement. So our solution is to cut the floor, put a pump in there, and that will ensure that any water that gets down to that area will be pumped out. So that is the facade section. Do you have any questions? No, it's a lot, but it's a very important piece of this whole puzzle is shoring up the face of the building. If not, we'll move. So we're going to do, there's a few floor plan tweaks on each floor, and so I'm going to go through those real quick here. So here we're looking at the basement, and in green are the areas that we're going to be renovating, and you'll see with the next click turns to red. So in the basement, the primary thing we're doing is updating the restrooms and the break room, reorienting the bathrooms to face this center corridor area. There's a lot of wasted space in the larger break room kitchen area. So if we could rotate the bathrooms, it just provides better accessibility to the bathrooms. So you don't have to enter the bathrooms from the kitchen. It actually opens onto the corridor. If you've been down there, it's actually elevated about 18 inches. And so we're going to drop that down to be flush with the rest of the basement floor. Some other things we're doing are adding locks and key card readers to some of the doors here to prevent people that just go down the elevator from wandering around. The only reason for the public to be down here is if they go see the chief building official, which that's going to be his new office right there. So we're basically locking it off from anyone from, again, going back into the break room or back into the corridor where we have some IT areas and storage with these new doors as well. And that's a theme that you'll see over the course of the next few slides is how we're funneling the public to where they belong and not where, you know, they get lost and are wandering around the back hallways. So we want to make this, keep the building very inviting, but secure it at the same time. On the first floor, we are going to be doing a few tweaks. One, we'll start in the lobby, and Brittany will explain what we're doing to make the lobby a little bit more attractive. One, we're going to be adding this small wing wall right here next to the utility and the tax office so that it stops you from just kind of doing a straight line into the planning office. I know a lot of times, like even the first time I came here, I just went straight for Kim Noblin in the planning office, and you know that's not her job, is to greet everybody. So we're going to put some signage along this wall here to show if you're just paying your bill at Texas Utilities, this is where you go, and if you need somewhere else, it'll direct you to that location. And so at the same time, we're also going to rotate around Kim's desk there, so she's not looking at you, you know, drawing you toward her if you're not meant to go to planning and development. We're also going to add a window to the permit clerk right here, so that again you're not kind of walking in the back planning office when those guys are working in their cubicles, and you're just kind of wandering around back there. So if we cut a window in this wall right here and add some seats, the people coming to get a permit there will have a direct shot and it corresponds with the permit person without having to go backside of planning. I'm going to clean up a little bit of the hallways back here to get you into the utilities office, and this go back. I think that's important. You know, you kind of got this snake around here to get back into the offices, so want to just create a straight shot there. So again, just clean up the flow of traffic. Now, one of the big things security-wise is the back doorway, which usually remains open, and there's not a video camera or a lock on that, so people can come and go if they knew to get in the back door. So we're going to add a new door back there with a key card entry and a camera, so that only staff can get to the back entrance, and that every person in the public has to come through the front door. But even if they do happen to get in, if it's propped open, the doors either way would also have a card reader on it as well, so they can't get in there. And the card reader, again, you've probably seen those things people put on their belt that the city staff will have that will open the doors that they're supposed to open. All right. Here's just so you can get a better feel for it. Looking at the planning office, adding a little bit of signage up here, and then showing how that office would rotate. And then here's the window into the permits. Okay, move into the second floor. So on the second floor, there's not any floor plan changes, but we are going to do a lot of work in this room. For instance, we're going to get rid of your track lighting here, unfortunately. We're going to take out the ceiling and basically rework all the lighting in this room with LED lights in 4 zones, so that, as we've seen today, you could have it on you guys or however far back you want it into the audience. All those, you know, we can push up and down for however intense you want those LED lights to be. We're redoing the microphone system and the speaker system. We'll replace the screen here with a smart TV. We'll also have a monitor on the other side, so that, again, if you guys can't see because of the pole, you can look that way and see the same thing that's on the screen here. try to get rid of the pole, but it's just not going to go away, unfortunately. We'll have lighting on the walls here to light up any portraits that you have. We have the mayor's here. All the pictures on the wall will have wash lighting. We'll have a HD camera for recording either the planning commission or the city council, and that will be stored in a DVR device, HD. So you don't need, with HD cameras, you don't need the intense lights that you guys have now, so it's be much cooler on you all as you're sitting up there. We'll also have an educational TV outlet for those guys to be able to plug into, as well as a connection for the press to tie into the audio visual. We are also going to be updating the blinds, so those will be automatic. Push the button, they go up and down. And
Will they help with soundproofing?
Brittany, will they help soundproof?
They don't have an acceptable value, but your whole sound system will be reworked as part of the project as well.
I mean, from the outside noises. We have a hard time because of traffic.
We'll look into it. Yeah. I mean, now that you say it, I can hear it right now that you mentioned it. So, okay, yeah, we'll have Grant look at it. Yes, sir.
The most important thing, would Ron Thomas get an honorary nameplate on his chair?
Lit.
We haven't gotten to furniture yet, have we?
No, ma'am.
What's gonna be on his chair?
No, ma'am. So that's and updating the finishes, which Brittany will talk about in a moment. New carpet, new paint. But this room, while the walls will be the same, will look a lot different and function a whole lot better for you all and your purposes for presenting, for being up there on the council and communicating with the cameras and the people in the audience. All right, so we'll jump to the third floor, where we do have a number of changes going on. So one of the biggest changes would be at the administrative assistants, the executive administrative assistants office, where it used to sit right here. Now it faces people coming off the elevator. We feel like that's going to be a much more welcoming and secure way for people to potentially get access to the executive assistant or the city administrator and the mayor.
That's the best thing you've done right there.
Okay. Well, then we have waiting space with seats and then a door with a key card reader on it as well. So even if Kelly's not up there, you can't just walk in and basically walk around the entire third floor. We've also added doors here. So again, you can't come off the elevator and go the back way. So again, when the public comes up there, either through the stair or the elevator, they're forced to go to the executive assistant to be helped. We are cutting Jeff's office in half and adding an office over here where the IT room used to be for a legal office. And then this is not city attorney, this is an HR area for people doing applications to come in and get an application from clerk. You're also moving the IT over here, shrinking the accounts payable office a little bit, updating the kitchenette, swinging the door to the storage around over here, again behind locked door. And then doing some of the upgrades in this room, similar to the conference room, where we'll have a smart board, better lighting, and redoing the ceiling grid up there as well. Did I miss anything? Any questions? So those are the floor plan changes that we are proposed at the moment.
Is all the HVAC going to be upgraded?
Yes, sir. Get into that in just a second. So here's a look at, again, that it's not exactly like this, but you can just get a feel for this kind of radius appearance with the wall up here and then a window that only has a certain opening. So again, you can't reach over and grab her. And she will also have a duress alarm similar to the utilities in the tax office. They have duress alarms to contact emergency services if someone is trying to do something they shouldn't be doing. And then here's the door with the key card reader on it, so no one can just get to the back of the third floor. A couple different views. So that's basically the look coming off the elevator. So again, I think it's an attractive way of doing it. And it also, she can see coming off the elevator, he or she, whoever's sitting there, and then you can see there where to go and be helped if you're just a member of the public. All right, and now I'll turn it over to Brittany, who will talk about the finishes.
Might be kind of hard to see. I might walk it around too. But our primary goal from a finish perspective said, we really focused on the types of hard surfaces on our public borders throughout and in the lobby. Eliminated all of the vinyl composition. Core machines and that, So I'm just going to give you guys a quick walk through the building, starting with the first floor lobby. So what we've got down here.
We had a smart board you could put it on.
There's something about being able to kind of touch it. So we're gonna have terrazzo in the lobby, similar to what you see at the police department. It's a nice, timeless touch with a nice corporate seal, same where you're at, nice little welcome to City Hall. And it's gonna have a really, really nice light and service well. It also really speaks to the era of the building, to the architecture here. Modern, classic. So from there, in all of our public spaces, we have a vinyl plank. So it's the wood, vinyl, it's really great. Stamp, not to clean, you don't have to have the, buffing, waxing, all of that kind of stuff. We're upgrading our wood tones just to give them a little more modern feel, but still nice and timeless, nothing too trendy. And then that's consistent from the basement all the way to the third floor. So any public foot traffic location will have that material. And we've got some carpets for selected areas. All but one are a carpet tile. They're all pollution dyed. So they're all really serviceable, really easy to clean. You're not going to have wear issues, but if you do, tile. So we've got our general office carpet here. It's kind of a block pattern. Has a lot of movement to hide foot traffic and that sort of thing. So that'll be in the staff offices and wherever you have open work area. So like tax, utilities. Here in council chambers, we have this really nice, subtle but sophisticated pattern. That stays within our color scheme. This carpet, it just gets a hair richer for our executives to be on the third floor. So that'll be in the conference room, upstairs, and then offices along the perimeter. And then we've done something just a little bit more interesting, just to differentiate the mayor's office itself. As you can see, we kept our color palette control so that it has a long life. We're not going to have colors that are going to trend in or out over the next few years. We want this to really stand the test of time. Bathroom finishes you see here. So just a really classic, clean door tile in a 12 by 24 format. So we're updating the size to update the look. And then we'll take that same material, just in a lighter color, of our front wall. Solid surface in there, and solid surface at any of our transaction counters. So it's the public counter on the first floor and the public counter on 3 as well. Quick, but I know your time is valuable in here.
Now, the kitchenette on the third floor, that's not gonna be carpet, is it?
No.
Okay,
That will be for this, for as part of the corridor. This
Okay.
finish will run.
run through there. Okay,
Yeah, there's a lot of clear, like.
yes.
So yeah, so. The cabinets will be in the two. Not the building. Functional.
Nice. Looks nice.
Thank you very much.
Just a little bit more.
I thought he was done.
We had a question.
Oh, that's
HVAC. That's your deal. All right. So now we're going to talk about mechanical lighting and technology. Touch on what we're proposing for the building. In essence, for the mechanical and HVAC, when we reuse the existing chiller, it's roughly 10 years old and there's nothing wrong with it, so reuse that. Do feel like we need to upgrade the boiler and the pumps. They are past their prime and are working inefficiently as far as energy consumption compared to what we could reinstall in its place. However, the piping for the hot and chilled water is fine, so we want to reuse that. For the first floor in the basement, reuse the air handlers that are down there because those are working fine. However, for the second and third floor, we did an analysis on does it make sense to reuse these units here that are in the wall. The fan coil units, not reuse them, but replace them or put in a brand new system, a VAV system, a variable air volume system that would be on the roof that would push air down into the second, third floor. So the guys asked us to look at that analysis on upfront costs versus payback over time. And so we did that for them, and I'm hoping the font doesn't mess up. Oh, good. So to replace the fan coil units on the second, third floor, to basically take those out and put a new one in its place, would run about $236,000 in upfront costs to take those out and put those in. However, to do a new rooftop VAV system and do all the work to get down to the second floor and all the new piping and duct work, that would cost about $495,000, a difference of $259,000. So that's obviously a lot of money, but does it make sense with the payback over time by using less energy with the VAV, which is a more efficient system? And what we found out, we did a very long calculation, but I just boiled it down to a few numbers here. Basically, in total, to run the fan coil unit system is $30,000 a year. To run the new VAV system is about $21,000 a year. So it's about a third more efficient. However, it's only a $9,000 savings on the year. So with the difference in cost and the annual savings, it would take about 29 years to pay back the more efficient system. So we didn't feel like in 29 years, whatever we install will be past its prime as well. So we felt like going with the replacement of the fan coil units, because those are a source of water leaking as well, would be the way to go. And so that's the direction that the city staff has asked us to go in. For lighting, basically we're going to take all the lights that aren't LED now, replace those with LED lights, put dimmers, occupancy sensors on any rooms that don't have those already. So again, we're using as little energy as possible, only using the energy when we need to use it. For technology, taking out all the data wire that's in the building right now and updating with Cat 6 wire to all the existing outlets and adding a few outlets around the building where we feel like it was necessary. So as far as internet speed and connection, you'll have as much as possible with the new Cat 6 wire, and that will last a very long time. And then bidding instruction. So again, I touched on it a little bit. So that's where we are right now with our development with the city staff and trying to figure out how best to bid this so that we get as many contract bids as possible that will be as fair as we feel like is possible. One of those ways is trying to figure out a phasing schedule. So I know this is too small to read, but I'm just going to try to describe what we're doing here. Is basically this building is occupied and is going to have to remain occupied while we're doing the renovation. So we're trying to figure out, do we start top down or bottom up on displacing people into this room specifically to work while their offices on the third, first, second floor are being redone. And so we're working at, do we take half a floor, a whole floor? We could fit 15 offices in here if we had to and squeeze people in there for a 3-month period while their areas are being redone. So we've introduced one proposal and the staff has this and they're working through their ideas of how best to displace people for as short time as possible, but also give the contractor a fair shot at having the space to be able to do their thing to efficiently work so they're not overburdened by either a too quick time constraint or bad accessibility. If they work on the third floor, we have to detail exactly how they access it. We obviously don't want them to come through the front door. So do we give them the back parking lot and make the staff move somewhere else temporarily and allow them access through just that elevator core? Do they use the older elevator? So those are kind of things that we're working through right now. I feel like we're going to get close to a good solution, but just want to let you know we're actively trying to work that out with the city staff, and that's where we are at this time. But the staff asked us to come in and kind of present everything and get your all's input while there's still plenty of time to make changes if you all feel necessary. So with that, where we are.
One question to Scott Reynolds. Is there a reason that there was no council member on this committee?
Hopefully because you all don't live here,
I got that, but it would have been nice to probably have a representative to kind of just oversee the people.
I'm not sure. I can
Especially on a
answer-
project.
I'm not sure I can answer
Write
that,
it
but
down, you know, any comments you have.
We're gonna be asked to approve it. I think that's-
just from my perspective, I don't make that decision, so I apologize. That would be from administration.
Just elected.
The other question I had, when you talked about getting it ready for bidding and stuff, it seems that we're having a very difficult time getting people to bid on our work. So are we gonna take a different approach? Are we going out and actually visiting, different contractors versus just saying, come pick up your specs and?
We have asked that for the last couple of architects we've hired, their plans and ideas. And the good news is with Brad out of Lexington and Mike local, we have asked them and charged them with trying to help us find as many contractors as we can through the projects that they bid, not only here locally, but also across the state. So we're actively pursuing the best way to get as many contractors as we can to bid on, not only this project, but
Any projects
any
coming up.
projects that we have. Yes, ma'am.
We want to engage those contractors and invite as many because of how complicated the project is. We're going to have them come through the building and walk through and see it. We want them to be as comfortable as possible, so they feel like they can put a good number to it. So we're going to do everything we can. If that extends the bid period a little longer than typical, then so be it. But we understand the situation and trying to get as many people interested as possible is what we're going to do. Right, and so we've talked about when to bid it, and when it's important for the tax office to have people to not be under construction. And so we think as we're working through this, it may work out really well that we're bidding toward the end of the summer in the fall so that this work actually is going on in the winter when contractors are looking for work. So, the way that the schedule's working right now, it's kind of in our favor to say, let's put this out maybe August and it bids in September. And then by, sometime October, November, they're ready to go to work and they have a project that takes them all the way through the winter. So we think that by itself will be an attractive thing for contractors to be looking at.
Scott, one of the things that some of us might remember about this building many, many years ago was the talk of the town was the electronic signage at that time, which was the only building that had its own electronic. I hated to see that go, and I blame Steve Park for that. Was any consideration given? I thought that was a neat thing,
It was. It was
a
great.
very
It was a
neat
great way
thing.
to
Was there
share
any
the work
consideration given to putting that electronic? I don't guess the mechanics or the guts are even there anymore.
Well, it seems like a lifetime ago for me for that to be on this building, and I apologize for that. I barely remember it, but
It was a neat
I don't
thing.
think we've ever asked them to look at that.
Okay.
Sorry, I apologize.
It was just it was the only one in town. That kind of predates me as mayor. But, it was neat. It was neat.
I think I remember seeing it, but I can't fully. Anything else?
Thank you.
Thank you all.
Thank you very much.
You want to move this over so I can get out.
No, I just did.
His wheelhouse is here.
Thanks. I just wanted to spend a few minutes tonight. I know we're probably running a little bit behind. I'll be as brief as I can. But I'm here tonight to advocate for the Hardin County Playhouse and tell you just a few of my thoughts on the situation as the way I see it today. And I'm going to be spending some time the balance of this week and then into next week lobbying my council members here and the city staff as well as the State Theater Board as well, because I think the Hardin County Playhouse and I believe the community theater in this town is worth saving. And I think it's a valuable part of our town. I think it is it's really high on the quality of life for those that are involved in that. And so I'm going to work hard to see what I can do to find a solution. A couple of observations. One, I've been here 5 years, and over the 5 years, whenever we've had disagreements on this council, I'm proud of the fact that we have always been able to find some common ground and work things out. And it might mean that what someone wants, they have to wait a little bit longer to get. But so far, we've always been able to do it. And we've also been able to do it even after we've already made a decision. We've been brave enough and bold enough that after we find out what the situation is and find out more facts, we've been able to change our mind and make what we think is the appropriate decision. The other observation that I've made over the last 5 years that I've been here is that the State Theater Board and the Hardin County Playhouse Group have been in constant conflict. And over that 5-year period of time, we've had our share of conflict with the State Theater Board. And as you all have heard me say many times, I think so many of our problems in our city is communication. And I think this is a prime example of where we're all doing a poor job communicating. And here's why. The State Theater Board has always been made up of a group of volunteers. They're our citizens, they're our friends, they're business owners, they're our residents. They have full-time jobs, they have families. And they do it for free. And they don't mean to make the situation worse, and they don't make it worse. They're just trying to do whatever we direct them to do and what we kind of insinuate that our wishes are. On the other hand, you've got the Hardin County Playhouse Group. They're just trying to provide a really nice theater for our community. And there's this constant conflict. And when you think about it, it's extremely difficult for both down there because the State Theater really wants to grow their footprint and they want to be a bigger and better theater and they want to offer more things. The Playhouse wants to grow. They want to sell more tickets. They want to have more plays. They want to have more kids. And it's a tough situation that the city has also thrown into the mix our concert series. So we've got 3 different groups using the same facility, trying to balance a schedule. And that's a pretty tough thing to do. But I hate to see one of those entities suffer the ultimate consequence, which is death of the community theater. There's got to be a way around this. There's got to be a way around it. And as I've been asking questions over the last couple weeks, we get into all of this he said, she said, we said, and they said. And they're conflicting stories everywhere. And nobody means anything about it. It's just that we all see things maybe or perhaps a little bit different. So I understand that there are some proposals that city staff has written on that might be a way to solve the problem. I would personally like to see those proposals. I have proposed that the city take over their facility, be in charge of their facility. It's not the only time that a landlord would have 2 tenants that share some space. There's got to be a way that we can fix this. It's not the best situation for Playhouse to be there on a long-term basis because they're going to need their own home. But if we do not find a way to keep the community playhouse intact, they will not revive themselves. It's too tough. They lose members, they lose supporters, they lose actors and actresses, they lose directors, they lose seamstresses, they lose people that build their sets, and other communities will pick up the slack, or they'll go find something else to do. And there's just got to be a way that I think that we can listen to the residents and listen to both parties, and we ought to be able to find a way to work ourselves through this. But my personal opinion is, unless we take charge of the situation, the one thing that remains constant is we've always asked the State Theater to be our communicator with the Hardin County Playhouse. And we're not communicating the way that we should communicate. So I'm advocating for them, not because I am their biggest fan. I'm not advocating for them because that's where they have to stay. But I do want them to stay in Elizabethtown, and I do want our residents to have some quality of life with community theater. And I hate to see the community theater be replaced with the things that I hear that they're going to be replaced with. And if they're not going to be replaced with the things that I hear they're going to be replaced with, then I'm even more upset about the situation, because if we don't have anything in mind down there, then why are we doing this? I think we need to put the brakes on with our decision and with what our direction has been to the State Theater. I think it's okay to change your mind. And then I'm going to ask for some more time next week, because we can't make a decision this week. But I'm going to ask for us to make a decision next week, because if we don't, the Hardin County Playhouse is not going to be able to exist for another year, because they plan their schedules 1 year in advance. 1 year in advance, their performances, 1 year in advance, their practices. So from a scheduling standpoint, we ought to be able to work this out. We know exactly when they're going to be there for the most part. And I just think the city ought to be in charge of the facility, and I think the city ought to be in charge of the schedule. And there should be a strict protocol for how you get on that schedule. And there's one person or one entity that controls the schedule. And it needs to be the city that controls the schedule.
I don't think, I'm all for the Playhouse staying down here. I think that it will not work if the State Theater Board and the Playhouse has to work together. That's not going to work. There's too many burrs already in place. Okay. I think the city needs to take over the running of the State Theater. This is not the first time this issue has come up, as Terry has said. I think we first need to make the decision that we're going to run the State Theater. We can have an advisory board. I think there are things that have been addressed about the Playhouse and where they go in there that can all be solved. And I think there's plans out there that we haven't seen yet. But in talking with staff, there are things in place. One is the accounting. Bring the bookkeeping over to ours to pay the bills and take care of that. We have personnel in place. We have the systems in place. But the first decision I think we got to make is we need to run the State Theater. I think it's going to be tough to lease as part of the space and not lease the other, because we have concerts and stuff. I think this all needs to roll underneath our event program here.
I agree. And I
think we can, the cleaning part has been the same issue as it's always been, so we know that. So in our talks with them, we are going to clean the building. And we'll have to adjust the price for that. But again, I think all those things are doable. There are doors that can be put up if some of the people during the rehearsal or whatever are wandering over into areas we don't need. There are some areas here that doors can be put up. And the city is the one that would have the money. I mean, we're already budgeting $75,000 a year over there to offset operating costs, not counting the other things that we're doing. And our personnel are the ones over there doing it. So I think a reallocation of current resources, as I like to say, can make this work. But I think the first decision for us is it's just not going to. There's too much water underneath the bridge between the two organizations.
And I agree. And the only last thing that I will say is I reached out to Mr. Gaddy this week. I had a phone conversation with him, not just because he is the chairman of the State Theater Board. And he agreed with me. And he says, Terry, I have said since day one, the city needs to take this over. And he agreed with what Marty's proposal is, that we take it over. He says, you're asking us to do something that we can't do. There's too many conflicts. And that's what he told me this week. So the only thing we have not tried to remedy the situation down there with two tenants in the same building, sharing some common areas, is the only thing we have never done is taken it under our own wing and provided the leadership that we need to provide to make sure that we keep both. We've never done it. We've never even tried it. I can't believe that this council, and I can't believe that all those involved would like to lose the community theater. A community theater cannot survive without a benefactor. The city has to be the benefactor. They cannot survive without us. We have to help them. and we have to advocate for them, or they won't stay.
And-
They can't stay.
And I agree with Terry. I think the Playhouse is the point. Maybe they're already there, that they've outgrown that space. I think ultimately they need their own place. And just as we stepped up with the Basketball History Museum, just as we have stepped up in other revitalization opportunities down here, you know, I think we can set a goal. And I know the council can change things, but if we start this process of looking at what that need is, you know, when as buildings and things come available, maybe the opportunities there for us to help them establish, if it's that important to us, again, with the revitalization that's going on downtown, to have them downtown, to see all those people. I mean, it's great joy to see all the people pouring out of the State Theater at night from the Clint White concert and the other concerts we have, and the Playhouse as well. And I know you look at the clocks, I'll stop.
Anything else?
Yeah, Mayor, I just need to clarify one thing. I spoke to John Gandy last night, and I think there's some things that he said that's been taken out of context. John said that if the board's decision is overturned, then the board would just quit and the city needs to take it over because they're volunteers. We told them to make these decisions, and he sees no point in the board existing if we're going to overturn their decisions every time they
I
make
agree
one.
with Bill
And
on
we-
that.
So he didn't say, hey, y'all just take it over. There was a little more context to that
No, he did not
conversation.
say that. He did say that it was his opinion, and it was his opinion from day one that the city be in control. But we told them to do it. And so they were doing it. And I just think that's a mistake. And I think that's where our leadership has been wrong. And I believe we have not had the communication. But we need to be communicating directly with our tenants. And if Hardin County Playhouse is one of our tenants, we need to be direct.
They're not one of our tenants.
They could be one of our
They're
tenants.
tenants of the State Theater.
That's right. And that's where the problem is.
And,
But that's where the problem is, Mayor. Well, they need to be our tenant because they're in our building, and the theater can be our tenant in our building.
and I believe it was a year or so ago that this council voted.
And we said, yes, you all run it.
And like I say, it's okay to change your mind and say you've made a mistake because it has not been effective. It's okay to change your mind. It's okay to say we were shirking our responsibilities. We've asked the State Theater to make tough decisions that we as elected officials and city staff and the owners of the building should have been making. It's okay to say we were unfair and asking all of you private citizens to do all of our dirty work for us. It's okay. But that's what we were asking. We should have been doing this all along. Now, we all agreed that we wanted the State Theater to do it. I'm not saying that. I was one of them. I'm saying I've changed my mind. We need to take control of the situation. That's what I'm saying.
Okay, let's go upstairs
upstairs.
and have a budget meeting, all right?
Let's slice them all.
That's
We
right.
got my new carpet for City Hall.
And doors and keys and
How'd you
alarms
do
and
with
bells.
She's doing so much better. I felt comfortable coming back.